you can't protect yourself from everything, but you can protect yourself against the measles. And measles is not just like a cold. Measles has a potential to be a really serious illness. You can get brain inflammation from it. You can get pneumonia from it. You can be really sick with measles. Now, most people are not that sick with measles, but many of them are. The ones who are particularly sick with measles, children and young people whose immune systems are not working properly. And many of you will have mates who have had cancer and who've had treatment or are still on treatment for cancer. And those children and young people are much more prone to getting really, really sick with measles. And it's one of the things that you can do to protect your mates and look out for them, is to make sure that you're immune to measles so that you can't pass on the disease if you were to catch it.
So, how do I find out if I need a vaccine? Because, I might have been immunised as a kid, I don't remember, or I might even have had measles as a kid, you don't remember these things. So what do I do then?
Well, there's some really simple ways to find out, and that is if you're living in the same place as you grew up, or you can ask your mum and dad who your GP was, and your GP is still practicing, they'll have a record of whether they've immunised you. So that's pretty straightforward. You can give them a call. The other way is if you've still got your Plunkett book or child health book, immunisations should have been written into the book, and your mum and dad will have that, or they may have given it to you, so you can just look it up and check in the back and see if you've had the measles immunisation. It's also possible to have a blood test to find out if you're immune to measles. But in reality, having another vaccination doesn't do any harm and will give you a lot more certainty about your protection. If you've had a measles vaccine before, you can always have another one. So the way I look at it is that why have 2 injections when you only need 1? You can ask for a blood test and then have a measles vaccination, but why not just have the vaccination? It's a disease that we don't have to have. So why wouldn't we try and get rid of it out of our environment, and then we can, after a few years' time when we've had no reported cases of measles anywhere in the world, we can stop vaccinating against it. And that sounds like a win for me.